Hey there, PT and PTA students. Welcome back to Studying with Stephanie. Today we are going to continue on the topic of spinal pathways and spinal cord injuries. We've talked about how the spinal cord pathways are similar to a delivery truck driver on a route delivering different messages to the brain or from the brain to the body for our body to respond. Today we're going to talk about the spinocerebellar pathway, and this is for our proprioception. And as a physical therapist, you know that proprioception provides feedback to our body to know where our limbs or our body parts are in space. So if I'm holding my arm up at about a 90-degree angle and my eyes are closed, my proprioceptors are going to feed that information to my brain so that I can know where my arm is in space without having to look at it. And that happens through our spinocerebellar pathway. So let's get into it. So because the spinocerebellar pathway provides proprioceptive feedback, this is going to be an ascending pathway or a sensory pathway. Spinocerebellar, we go from the spinal cord to the cerebellum. So that is telling you that this delivery truck driver travels from things like our joint, our muscle, and our tendons all the way up through our spinal cord until it gets to the cerebellum in our brain and can articulate that information. Our body is then going to send an impulse back down in order to fine tune and really fixate on what the position of our limb should be. So the first part of our spinocerebellar pathway that we're going to talk about is our dorsal spinocerebellar tract. This is going to lie within our thoracic spine, and it is going to provide the proprioceptive feedback from our trunk and our lower limbs. It's going to travel up the spinal cord on the same side, so it's going to be ipsilateral until it hits the inferior cerebellar peduncle, where it's going to then relay that message. We also have the ventral spinocerebellar tract. This is going to be in our lumbar and our sacral regions. This is going to be more of an internal feedback system for our internal proprioception, and this is actually going to cross over at the spinal segment and then again in the brainstem. And then it's going to go through into the cerebellum through the superior cerebellar peduncle. Moving on, we have our cuneo-cerebellar tract, which is going to provide feedback from our neck and our upper limbs. This is going to be actually in our medulla, so in our brainstem, originating from what we call the cuneate nucleus. This is going to go up through the cerebellum, and it's going to enter through the inferior cerebellar peduncle. Lastly, we have the rostral spinocerebellar tract. This is also going to provide that proprioceptive feedback from our upper limbs, but it is going to go up to the cerebellum through both the superior and inferior peduncle. So as you can see, our body has a lot of different pathways that provide us that proprioceptive information so that we can be aware of where our body is in space, help to coordinate motion, get better fine motor skills, help with our balance and our posture. When we know where our body is in space, we are able to really produce more efficient and more effective motion. And this comes through our spinocerebellar tract. And that goes again from the sensory organs within our tendon, our muscles, our joints, through the spine and up to the brain. So again, spinocerebellar. When we have issues with the spinocerebellar pathway, it can lead to things like poor coordination and ataxia, which we see a lot when it comes to physical therapy. So understand that this could be affected through the spinal cord itself, through any spinal cord injury, or even any brain injury, any traumatic brain injury, stroke, things of that nature can affect this pathway, whether it's affecting the actual transmission and the actual road that this delivery truck driver is driving on, or it's affecting the relay center, the part of the brain that is reading and deciphering what this information is in order to relay a proper motor output. The spinocerebellar tract really helps us get a better grounding of our environment. It helps us as a body interact with our environment, to be aware of our own self within a space, and to really feel what's going on within our body and be able to provide that information and that relay back so that we can fine tune and improve our coordination and our gross motion. So that is the spinocerebellar tract. I hope that this video helped you. If it did, please drop it in the comments, like and subscribe, share with your friends if you found this helpful. And if you want to see any additional information, anything that relates to physical therapy and studying through all of the tests and all of the information that you're taking in as a student, please let me know. Drop it in the comments below. I am so happy you joined me today, and I hope you have a great day. Bye.